Hello, my name is Grace Culbreth, and today I will be talking to current and future speech and language pathologists regarding a complex ethical problem that highlights the American Speech and Hearing Association's Code of Ethics as well as evidence-based practice. The complex ethical problem being proposed today is about a 62-year-old man named Paul who was referred to a speech and hearing clinic by his vascular neurologist after suffering from a stroke in the frontal region of the left hemisphere of the brain, the Broca's area. The Broca's area is the motor speech area of the brain and is utilized in the production of speech. The SLP knew this information and was also met with the knowledge of Paul's means of communication, which was mainly nonverbal and didn't always contain full semantic content, which means that the information that Paul was able to communicate didn't always have full or accurate meaning. Paul was aware of these difficulties that he was facing and he was easily frustrated by it, yet the clinician viewed this behavior as a lack of intelligence. The clinician also knew that Paul was unmarried and was cared for when needed by his sister. Given all this information, the SLP decided to use an oral motor examination on Paul to discover that he was presenting with aphasia. Aphasia is typically defined as the loss of ability to understand or express speech. Due to this information, the SLP called Paul's sister into the room with them while she gave her analysis of the data she collected from the oral motor examination. The SLP told Paul's sister that through therapy, Paul would be able to regain his speech and also understand other speech better as well. She also promised Paul's sister that Paul would be able to get his part-time job back eventually, and that his relationships would no longer be affected by the communication disorder. Then the SLP asked Paul's sister for consent for Paul to begin therapy. This scenario shows an SLP breaking the ASHA Code of Ethics as well as not accurately following evidence-based practice. The ASHA Code of Ethics is a framework that summarizes the values and principles that are associated with being a speech and language pathologist. In the ASHA Code of Ethics, Principle 1, Rule M, it states individuals who hold the certificate of clinical competence shall use independent and evidence-based clinical judgment, keeping paramount the best interests of those being served. This SLP did not use evidence-based clinical judgment because she only used an oral motor examination to make Paul's diagnosis. Instead, the SLP should have done, in addition, the French aphasia screen test. What this assessment tests is comprehension, verbal expression, reading, and writing. And what this could have found is that Paul's behavior is not due to a lack of intelligence, but instead he has Broca's aphasia, meaning that Paul can understand verbal speech and writing. Another part of the ASHA Code of Ethics that this SLP broke is Principle 1, Rule L, which states individuals may make a reasonable statement of prognosis, but they shall not guarantee directly or by implication the results of any treatment or procedure. Instead of the SLP promising Paul's sister that Paul would be able to regain his speech and return to his part-time job after therapy, the SLP should have shared with Paul his long-term goals and short-term goals and made clear that she will try her best to help him reach these goals. Lastly, the ASHA Code of Ethics Principle 1, Rule H was also broken, which states individuals shall obtain informed consent from the persons they serve about the nature and possible risks. If diminished decision-making ability of persons served is suspected, individuals should seek appropriate authorization for services. This SLP did not give Paul the chance to make conformed consent before referring to his sister. Instead, what the SLP could have done, besides giving Paul the accurate assessment in the first place to discover if he was able to understand verbal or written communication, was to create a sheet for Paul that has short sentences, bolded keywords, and illustrations, and gives Paul the chance to checkmark boxes that he understands what he's reading and also what he is consenting to. Next is evidence-based practice, which is composed of three main components that are linked together to allow clinicians to make informed and evidence-based decisions while providing the highest quality of services to those with communication disorders. The evidence-based practice section of external and internal evidence was not correctly followed by the SLP, which states that an SLP will utilize the best available information gathered from scientific literature and from data and observations collected on your individual client. The SLP did not utilize the information she was given when Paul was referred by his neurologist. She did not take into account the area of the brain that the stroke occurred in when deciding what assessment was best to give Paul. What the SLP could have done differently is educate herself on how to best assess a stroke survivor in that particular region of the brain. Overall, this ethical problem demonstrated the ASHA Code of Ethics as well as evidence-based practice and how a proposed solution can help fix or avoid these problems. Thank you.